Okay, this is in no way sponsored or endorsed by the Department of Defense, Department of the Army, or Department of the Navy, or the National Institutes of Health. This is the Synergy program. You enter the patient's last name, first name, height, weight, and gender, and then a brief history. Don't get crazy. Just examine either the upper extremities or the lower extremities. Now we're going to get set up. You need to have your tape ready. And while we're getting this set up, here's the head box. And you put the black in here, the red in here, the green in here. That's the stimulator. The light indicates the cathode. And this little dial increases or decreases the strength of the stimulus. And before you start shocking, you always have to turn this on. It'll remind you if you don't. Okay, so we're putting the electrode ground on. Always put gel on your electrode ground. That's the green paddle. And generally when we're doing studies in the hand, or the upper extremity, it goes on the dorsum of the hand. Now we have to measure. There's a purple skin marker to the left of the head box. You're going to make a mark at the base of the thenar eminence and a mark at the base of the hypothenar eminence. Then you're going to measure 8 centimeters. So from the hypothenar eminence, you're going to put your dot in between the 2 tendons in the middle of the wrist, and that's for the median nerve. And then for the hypothenar eminence, you're going to go just lateral to that tendon on the medial side of the wrist, 8 centimeters. 8 centimeters. Terrific. Then we take the bar electrode, put some gel on it. Okay. And you put it over the dot on the wrist for the median nerve. The black dot is G1, and that's what's going to go on the dot. And for sensory studies, we like to wrap the wires, put them under the patient, try to decrease the length from the head box to the patient as much as we can. And this is just some of the tricks that will make you look fabulous. Okay, and on the computer over here, we have to choose right median versus ulnar palmar. So we're doing the right upper extremity. Always put gel on the stimulator, as such. Now the cathode goes toward G1. And when you stimulate, you start with low. Head box not on. It'll remind you. Okay. And then you stimulate and you'll get that little noise. And then you increase until you've essentially maxed out. And there are normative values for our lab. Very normal. Terrific. Now we turn the head box off. We need to switch our electrode over to the ulnar side. And then we repeat the same procedure on this side. And remember that you always have to switch. You can either push the little M on the hand wand, or you can use the control box and push next. Control box is over there. Okay, and all that noise you're hearing is surface EMG. So you ask the patient, please relax your hand, and there it goes. If you don't advance to the next study, you're going to record over what you just obtained. So you do the same thing in the ulnar. And again, you max out. Looks very normal. You've just completed an ulnar versus median palmar study.